webinar on-site and online. In the last 2 years, the world in Vietnam has undergone a lot of challenges and difficulties as the result of SARS-CoV-2 pandemic. COVID-19 pandemic has been causing economic, social, and environmental consequences, including economic recession, losses of jobs and income, many poorer communities falling into even more severe poverty, medical wastes, and plastic wastes surge. And not only that, COVID-19 has also caused national governments and governments at all levels to face a lot of confusion in governance, administration, policy implementation, and public service delivery, particularly in the face of Delta and other variants, including the new emergence of Omicron. And in order to find out about people's opinions and experiences on the government's responses to COVID-19 pandemic from the perspective of governance and public service delivery in 2021, and to propose recommendations to authorities at all levels in responding to the current complicated COVID-19 pandemic developments or similar situations in the future. Over the past 2 months, the Mekong Development Research Institute and the United Nations Development Program has been conducting a round 2 sociological study, a phone-based survey after the first round of the survey conducted in 2020. And this is a thematic research supplementing to the PAPI research. And the Australian DFAT is sponsoring this program. The survey was conducted by phone from September 17th to October 15th, a few days after Directive 15, 16, and 19 were replaced by Government Resolution 128 that temporarily adopting the regulations for the period of safe adaptation, flexibility, effective control of COVID-19 pandemic. And today we are hosting this webinar to share the results of the survey. And I'd like to warmly welcome all the delegates who are participating both online and on site. And to start with our program today, first of all, I would like to welcome Ms. Caitlin Wilson, Chief Representative of UNDP Vietnam, Ms. Sherry Russell, Development Counselor of Australian Embassy in Vietnam, Dr. Phung Đức Tung, the Director of Mekong Development Research Institute. And in the section on sharing our survey results, I'd like to introduce Dr. Nguyễn Việt Cường, Deputy Director of Mekong Development Research Institute. And in a panel session, we would like to welcome Madame Phạm Chi Lan, the independent senior economist, Dr. Nguyễn Anh Chi, a member of the Parliament and member of the Committee on Social Affairs of the National Assembly. Professor Chi is also joining this webinar via Zoom. Madam Nguyễn Thị Lan Anh, the Director of ACDC, who is here with us. Dr. Chuyên Minh Huy Vũ, the Director of Software Tech Park in Ho Chi Minh City ITP, who is the Deputy Head of the Advisory Team on Prevention, Control, and of Pandemic and Economic Recovery, to the Chairman of Ho Chi Minh City People's Committee, Dr. Nguyễn Thắng, Vice Chair of the Socioeconomic Development Policy Advisory Team, VASS. And in the closing part, we will welcome Ms. Diana Torres, Assistant to the Resident Representative of UNDP, Head of Governance and Participation. And Ms. Diana Torres will give us closing remarks, and we would like to welcome all participants who are joining the webinar online and on-site from central and local government authorities, media agencies, non-governmental organizations, and civil society organizations, embassies, and development um, cooperation organizations in Vietnam, and academia. And this webinar is now live streamed on the Facebook, Vietnamese Facebook webpage of UNDP and Mekong Institute, and English via Facebook Party Vietnam, via the links that we've sent to you. And we'd like to thank all the team for their support to us in organizing the event today. And to start with our program, I would like to invite Madam Kathleen Wilson, the resident representative of UNDP Vietnam, with the opening remarks. The floor is for you, Ms. Kathleen Wilson.
Dr. Phong Duc Tung, President Mekong Delta Research Institute, Ms. Sherry Russell, Development Counselor, Australian Embassy here in Vietnam, our distinguished panelists and presenters, ladies and gentlemen. It is an honor and privilege to welcome you today to the launch of the key findings from our second round survey to hear citizens' opinions of and experiences with government responses to the COVID-19 pandemic in Vietnam. The survey was conducted by the Mekong Delta Research Institute and UNDP during September and October 2021 amidst the dramatic fourth wave of the COVID-19 pandemic here in Vietnam. This wave has sadly claimed more than 25,000 Vietnamese lives and affected the health of more than 1 million Vietnamese people. So we would like to start with our heartfelt condolences, which go out to the Vietnamese families who have lost loved ones during the pandemic. This phone-based survey took place when there were full lockdowns in a number of cities and provinces, especially the heavily hit epicenters of Ho Chi Minh City, Binh Duong, Dong Nai, and Long An, as well as strict restrictive measures applied in many parts of the country, including in Hanoi. Our great thanks to the consent and participation of 1,500 respondents, starting from the ages as young as 18 years old. The data collected has been useful for us to understand how the fourth wave has affected citizens' well-being, public trust in government, responses to the pandemic, the accessibility of government's aid packages, and the use and accessibility of basic services in provinces. The survey also provides important insights into citizens' opinions and suggestions for the government to address the pandemic and its severe impact as the COVID-19 situation continues to evolve with the emergence of new variants, most notably Omicron. In December last year, when presenting the results of the first round of this survey, I highlighted that Vietnam's experience and success in containing the pandemic in 2020 had brought forward new insights and lessons on how governments could address complex and unexpected challenges like the ones posed by the global pandemic. In addition to the public health measures, Vietnam's success was attributed to the great efforts made in sustaining high economic growth while ensuring incremental improvement in governance and public administration performance for a decade before the arrival of COVID-19 in 2020. Nonetheless, as the Delta variant surged in Vietnam since May 2021, the fourth wave has exposed significant challenges to public health, the economy, and well-being of the Vietnamese people. In fact, one of the key issues that the Vietnam Provincial Governance and Public Administration Performance Index, or PAPI, has pointed out is that over the past decade, there has been suboptimal performance of public hospitals at the district level, which are now an important element, if not critical, in the response to the public health crisis. In today's event, we are pleased to share the results and findings of the second survey based on citizens' feedback and preferences, which we hope will inform the responses of central and local government in moving forward. The Vietnamese experience has demonstrated to the world that public trust and confidence underpin success in government responses. So let's really zoom in on what citizens have to say about the impact of the fourth wave from our second round survey. And now I would just like to highlight 3 important findings from the survey itself. Firstly, citizens have become even more concerned about the impact of COVID-19 and their well-being, and which has been more severely affected by the pandemic in 2021 compared to 2020. The survey respondents are most concerned about their children's education, and then, secondly, about their health. They also feel very worried about their livelihood and businesses. More than 70% of the respondents explicitly expressed such worries. Furthermore, a large proportion of respondents reported a loss of income, with nearly half saying they lost 51% or more of their income, and 1 in 5 losing all of their income. These are significant. More respondents reported income losses in 2021 than in 2020. And just to highlight, that was 77% in 21 compared to 65% in 2020. Similar to our findings from the first round of the survey last year in September, those working in the service and agricultural sectors are more prone to job and income loss, along with unskilled workers, non-farm workers, and the poor. However, despite such hardships, as many as 83% of respondents agreed with the following statement: the government's highest priority should be saving as many lives as possible, even if it means the economy will sustain more damage and recover slowly. Secondly, I'd like to highlight that the government responses to containing the COVID-19 Wave 4 outbreak remain highly appreciated by most respondents. Although they were less positive in 2020, respondents showed still their strong consensus on support for government policy and actions to contain the pandemic. Somewhat fewer said the central government's response was very good in this round, while commune-level government response and village head roles were more appreciated. However, such positive responses varied across provinces. In the heavily hit epicenters, including Ho Chi Minh City and Binh Duong, Dong Nai, and Long An, there were less positive feedback than in other provinces. Also, it is noteworthy that although facing job and income losses, a significant majority, or 78%, expressed their strong support for strict measures like full lockdowns and curfews that were applied in heavily hit epicenters. Furthermore, all respondents supported mask mandates, which is quite impressive, or very impressive, when we compare to many other countries globally at this time, while fewer would support closure of wet markets or schools. Most respondents said that provincial government responses were timely, although 11.5%, especially those living in the epicenter, said that actions by their province or cities in response to COVID-19 were too abrupt, leaving little time to adjust. Thirdly, the survey findings show that respondents are more critical of their government's 26 trillion Vietnam aid package in 2021 compared to 2020. About 70% of the respondents were aware of the package, while last year 87% had heard of the government's 62 trillion Vietnamese dong package. Ethnic minorities, women, poorer and rural respondents were less likely to be aware of the package, which is concerning. Also, fewer respondents, 13% less, reported receiving support from the 2021 package approved in 1 July of this year, compared to 2020 with 21%. The percentage of rural respondents receiving the aid package was only half that of urban respondents. Many poor, farming, self-employed respondents said they had not received support. Equally important, respondents' assessments of the procedures to access the government aid package this year was less positive than in 2020. Having said that, those who did receive the support said that the amount was delivered as informed and in a timely way. More importantly, also during this hard time, the government has not been the only source of support for those in need. As this year's survey finds, support from non-governmental organizations, social organizations, charity foundations, and individual donations were remarkable for those who did not have access to the official aid package. Our colleagues at Mdri will share more results and in greater depth provide us food for thought and suggestions for actions for moving forward. The year 2020 is coming with unforeseen challenges ahead of us because the pandemic is still with us and surging in many parts of the world. The impact of the Omicron variant and the risk of further new variants emerging remains to be seen. But with the fast and impressive delivery of COVID-19 vaccination here in Vietnam in recent months, together with citizen support of mask mandates and the government's agile responses, I believe that Vietnam is well positioned to overcome the pandemic challenges and to recover soon. I would like to take a moment and clarify what the survey does and does not cover. It may not reflect the COVID-19 impact on people with disabilities and migrants because it did not target this group explicitly. However, I do want to share with you, in 2021, UNDP Vietnam has also conducted the second round of rapid assessment of challenges faced by persons with disability, covering the period of the fourth wave of the pandemic in Vietnam. We hope to release the findings in January 2022. On immigrants' feedback, we will hear their voices in our 2021 PAPI survey, the findings of which will be released in April or May of 2022. Finally, on behalf of the conveners of the research, the Mekong Delta Research Institute and UNDP in Vietnam, I would like to take this opportunity to thank the Australian Department of Foreign Affairs and Trade for their partnership for this study, in addition to their generous support for the Vietnam Provincial Governance and Public Administration Performance Index, otherwise known as PAPI, towards 2025, together with Irish Aid and UNDP. We hope that you will find the findings insightful in helping to understand Vietnamese citizens' perception of and experience with government responses to the COVID-19 pandemic, especially during the fourth wave this year in 2021. With the agile response of the government and their policies to contain the pandemic, combined with the continued support from the Vietnamese citizens, I believe that Vietnam will soon chart a pathway to recover from the pandemic's social and economic impacts. Thank you. Chúc sức khỏe. Xin cảm ơn.
Xin chân thành cảm ơn bà Caitlin Wilson.
Very much, Ms. Caitlin Russian. And now we would like to invite
Good morning. Ms. Caitlin Wilson, Resident Representative of UNDP in Vietnam, Dr. Phung Duc Thong, President of the Mekong Development Research Institute, distinguished participants here today, as well as those joining us online virtually. Ladies and gentlemen, it's a pleasure to be here today to jointly launch the results of the second survey of the citizens' experience and opinions on the government's response to COVID-19. I congratulate my colleagues from UNDP and the Mekong Development Research Institute on this important piece of work. The launch of these survey results is very timely as we contemplate living with COVID-19. I arrived in Vietnam only 4 weeks ago, and this is my first opportunity to attend an event at the UN House. I'm delighted to see people able to reconnect with their colleagues as well as their loved ones in person and get back to their livelihoods, and businesses resuming their operations. I've heard a lot about Vietnam's impressive unity and determination to control the transmission of COVID-19. It has not been easy these past 2 years. We all recognise the cost in human suffering, lost potential and cost to the nation's development brought about by the pandemic. Australia will continue to stand with Vietnam as a reliable partner throughout the pandemic and our shared recovery. In partnership with the government of Vietnam, we are supporting the rollout of vaccines, including by ensuring Vietnam's reach remote provinces and the most disadvantaged communities. Australia has committed to share 7.8 million COVID vaccine doses with Vietnam. We know vaccines are a pathway to enjoy opportunities like Tet and to reconnect with family and friends under more normal circumstances. In addition to purchasing vaccine doses, Australia has committed 970 billion dong for the storage and delivery of vaccines, training Vietnamese health workers and communication campaigns to address vaccine hesitancy and maximise vaccine coverage in remote communities. However, we know that there have been profound socioeconomic impacts caused by the pandemic, especially amongst vulnerable people. According to a UNDP rapid assessment released in September, 64% of all households experienced an income drop of 30% or more. 83% of respondents reported the need for assistance. It's therefore timely to be here today to launch the Round 2 survey results of citizens' opinions of and experiences with government responses to COVID-19 pandemic in Vietnam. We know effective public health and policy responses depend on the trust and cooperation of the communities that they are designed to support. When citizens trust their public health authorities, we see enhanced compliance with difficult measures like extensive contact tracing, quarantine and lockdowns. The UNDP's Public Administration Performance Index, or PAPI, research program has shown that trust is improved with stronger governance and responsiveness of central and local governments. Through these survey results, we have an important opportunity to hear the voices and experiences of Vietnamese citizens. The survey provides valuable data on COVID's impact on individuals and the community. It examines the important issues of income and livelihoods, as well as people's perceptions of government response measures. This evidence then informs policy decisions and builds more trust within communities for delivery of these policies. These Round 2 surveys give policymakers the ability to rely on robust and reliable data. It provides policymakers confidence they are making decisions with the best available information. The survey respondents for this work were broad and included many communities that received migrant workers who returned home to their provinces during the fourth wave of the pandemic. The experience of these migrants and their communities is vital to the nation's economy, as are the views of women and girls and people with a disability. Vietnam now has the opportunity to enhance its public health response during this important next phase and any future public health crisis. The PAPI research has already contributed to the country's effective response to the global COVID-19 pandemic. Round 1 of the surveys in 2020 was used as a reliable source for evidence-based policy dialogues and discussions at national and subnational level. Its findings informs measures to enhance Vietnam's response, including the impacts of COVID-19 on human rights. Australia's support for the PAPI program recognises policy challenges are complex, and many of the solutions are contested. Different groups within the community have different views, and this important work allows these views to be captured and considered by the policymakers. Here in Vietnam, and also in Australia, we are moving into a new phase of the pandemic. As the vaccine rates increase, we are learning to live with COVID-19. This phase poses new challenges, even as we enjoy new opportunities to rebuild our lives and reconnect with our communities here in Vietnam. Australia is proud to be able to support this piece of timely and insightful research. We'll continue to partner with the government of Vietnam to support its efforts to help affected populations, including women and girls, people with a disability, and the most disadvantaged. In closing, I thank UNDP and the Mekong Research Institute for their important work in coordinating this initiative. Australia will continue to be a reliable partner to the government of Vietnam in improving governance and public administration, and through that process, creating a safer and more prosperous Vietnam. Finally, I would like to wish you all safety and good health. Thank you.
Xin chân thành cảm ơn bà Sherry Russell.
Ms. Cheryl Russell. And now I would like to invite Dr. Phùng Đức Tung, the president of Mekong Development Research Institute, with his keynote speech. The floor is for you, Dr. Tung. Ms. Kathleen Wilson, resident representative of UNDP Vietnam. Ms. Sherry Russell, development counselor of Australian Embassy in Vietnam. Panelists, participants to the webinar, ladies and gentlemen. First of all, on behalf of the Mekong Development Research Institute, I would like to sincerely thank UNDP for continuing to trust us and entrust us to conduct the survey on people's opinions of and experiences with government's responses to COVID-19 pandemic in Vietnam, findings from round 2 phone-based survey. And I would like to thank DFAT for funding this research, very timely research. Yes, this is a very timely and important study to reevaluate policies to respond to the last outbreak, the fourth outbreak of COVID-19. As you all know, the fourth wave of COVID-19 has occurred in Vietnam this year, and it had had a very severe impacts on almost all socioeconomic sectors and affected the entire Vietnam population. The scale of the impact of the fourth wave of the pandemic is significant and spreads across the country. However, the extent of impacts caused by the fourth wave of COVID-19 varies quite a lot among different groups, different individuals, groups of households, provinces, and regions. Therefore, the government as well as authorities at all levels have launched a series of different response measures, including measures to prevent the pandemic and support policies for affected subject and affected populations and areas. And so this is a very important time for us to look back at that, because the wave of the epidemic has temporarily subsided, and it is time to evaluate and review the response measures and support policies, as well as the experiences of those who have been severely affected in the past. From there, lessons can be drawn for development of more appropriate responses and policies for the future. Therefore, round 2 phone-based survey of people's opinion and experiences with government's responses to COVID-19 pandemic in Vietnam was conducted during September and October 2021. The results will provide us with a full picture with concrete evidence of the negative and severe impacts of the fourth COVID wave on different population groups, as well as the effectiveness of policies that the government has been implementing. And the survey was conducted on a scale of 1,500 people, of which 1,300 people were participants in the first round, and an additional 200 people in the most affected areas, including Ho Chi Minh City, Dong Nai, and Binh Duong. And they were randomly selected in the survey, and this is a highly representative sample survey, which ensures the reliability of the calculator criteria used for calculations. The survey's results have very interesting findings, as there is a saying in Vietnamese that only when you lie under the blanket you will know that there are lice in the blanket, which means that there have been a significant large differences in the experiences and opinions of the people with the responses and policies of the government. And I think that it also gives us a lesson in policy development. We need to be able to put ourselves in the shoe of the affected people to design the policy appropriately. And this survey would not have been possible without the enthusiastic and professional support of the PAPI technical team. And I'd like to express my sincere thanks to Ms. Do Thanh Huyền, Mr. Adi Maleski, Mr. Paul Schuller, for supporting us in the design, data collection, and analysis process. And sincere thanks to the households participating in the survey for providing information. The survey team patiently explained and persuaded the participating households. And the Mdri team, who went a great length to get this report to everyone today. Thank you very much for your cooperation. Dr. Phùng Đức Tùng. And next, I would like to invite Dr. Nguyễn Việt Cường, Vice President of Mdri, who will be sharing with us the key findings of the survey. The floor is for you, Dr. Cường. Ladies and gentlemen, on behalf of the research team, please allow me to share with you the key findings from the survey. And me, myself, Ms. Huyền, UNDP, Mr. Long, Ms. Phượng, and Mr. Tung from Mdri are the key members of the survey team. And we are also supported by our international colleagues. In my presentation, we've got about 30 minutes for this presentation, so please allow me to go through the context first. And so I will be very brief because my colleagues have already mentioned it in their remarks. And so the main parts of my presentation today, including the analysis of people's opinions and experience with the responses of the government. And finally, some policy recommendations. So we know that last year, Vietnam was fairly successful in achieving dual objectives of containing the pandemic and economic growth, but the Delta variant made it very difficult this year. And as a result, we see that the pandemic spread throughout many cities and provinces. And the only thing that we could do is to apply strict lockdowns. And strict restrictive measures have been applied, including lockdowns, curfews, school closures, and barricades. And it dragged our economic growth to below zero in third quarter. And despite the support from the government and charity organizations, the impacts of the pandemic were severe, and many workers had to travel back home to avoid. And so we see for the first time in history the wave of migrations of million people from southern provinces to different provinces of Vietnam. We have heard a lot of debate and discussion and reporting on mass media on the impacts of COVID-19. However, complete research on the pandemic and the impacts on the people and the responses of the government has been limited. That's why with this survey, we attempt to provide more colors into the pictures and more information into the picture of the people's experiences the impacts of the pandemic on the people and also the experiences with the government's responses. And for that purpose, we conducted this phone-based survey right after the removal of the strict lockdowns. We conducted a phone-based survey for 1,500 people based on the PAPI framework 2019. So the survey collected information from 14,000 people randomly selected. That is for PAPI. So we also randomly selected 1,500 people from that data sample panel. And this sample is also representative. However, there is a limitation that the panel for 2019 only covers people, citizens with permanent residency registration and did not include migrants in the sample. That's why somehow it does not capture the opinions and experiences of migrants. So in the PAPI survey after that, the panel has been, the sample has been updated and expanded. But for this survey, we just got the responses from 1,500 people who were also 1,400 who were part of the PAPI survey. And so the sample is fairly representative, including different demographic groups and coming from different provinces, ensuring representation throughout at the national level. And now allow me to get into the first part of the survey findings, the key findings of the survey. And firstly, the impacts of COVID-19 pandemic on social and economic aspects. So we see that all citizens have felt that the impact of this wave of COVID-19 has been more severe, more negative than last year. And this is not only at the national level, but also at the individual level, because the respondents said that the new wave of COVID-19 severely affected their businesses. So if we look at the family business, we see that if last year the very negative responses was 53%, then it increased in 2021. We also found that people became more concerned about the impacts on health. So last year, Vietnam was successful in containing the pandemic with less than 100 deaths. But this year, it amounted to more than 26,000 with 1 million infections. And it has never been before that people would feel so that they were trapped into such a dangerous situation, that the risks are right next to them. And another finding is that with this survey, people are worried not only about the well-being and health, but also their children's schooling. Last year, we see that the lockdowns period was shorter. However, this year, children from almost all provinces have to receive online schooling services. That's why a significant percentage of respondents say that they are very worried about their children's studies and schooling. So further, about economic impact, we asked how COVID affected people's jobs and income. So 24% of the respondents said that COVID-19 caused them to lose their jobs,
and it is similar to last year, 2020. However, the impact on income this year is higher than last year. So last year it was only 65%, and this year 77%. So significantly higher than the 2020 figure. And also, there is a group that were heavily affected, saying that they lost all their income. So breaking down further into different groups, we found that the unskilled workers and non-farm workers and the poor were the most affected. So they were much more severely affected than the rich and middle and near-rich population. The impacts of the pandemic came about through lockdowns and distancing. So we look at the level of the impacts due to the length of lockdown, and we also break down by provinces with different levels of infection. So we see that in the areas with higher, longer lockdowns, then the impact on income was also much higher. And one of the consequences of the reduced income was actually the impact on nutrition. And in the survey, we tried to understand how these affected the ability of people to buy food. And we also asked whether the respondent family had to skip meals. And we also see that since early August this year, the percentage of families that had to skip meals due to lack of money to buy food was really high among the poor. Those who already have poorer nutrition intakes than other population groups, and it became even more so during the pandemic, during the lockdown. So COVID-19 caused a more severe impacts in 2021 than in 2022. So the question is how people would cope with their reduced income. And we asked the people about the measures that their families had to take to cope with loss of income. So they had to cut down their spending, including spending on food. And we also conducted analysis for the poorest and the richest quintile. And so we see that there is a difference between these two groups. So we see that the richer people had means to cope with the difficult situation, while for the poorer people, they don't have savings, so they cannot resort to use of their savings, but they had to go out and borrow. And it is very risky to them, particularly when they given the fact that it would be very hard for them to borrow from banks or low-cost sources. And also, they would have to do more on their farming in order to provide for their necessities. On this slide, you can find the impacts of COVID-19 on socio-economic situation. And so this year's wave of COVID-19 is found to affect much more and causing more severe impacts. And also the impact is not only on the economic side, but also health of the family members and education of children. So now allow me to talk about people's opinions about the responses adopted by governments. So generally speaking, people still appreciate the responses of governments at all levels. More than 80%, almost 90% of respondents said that the responses are fairly good. However, these positivities reduced against last year. So we see that there is a reduction of very good responses represented by the dark green color here. So we see that this year, fewer people have positive opinions about responses of the governments. Then, of course, when we fail to contain the pandemic, it aggravates the opinions from the people about the effectiveness of government's responses. So to go into more detail, let's look at this. Now we look at the percentage of respondents talking positively about government's responses in different cities with different levels of infection. For example, less than 0.1% or more than 0.1%, etc. So we see that in the provinces with more cases of COVID-19 per 1,000 people, the assessment of the people about government's responses was less positive. Let me get into specific measures to see how people see these responses. So even though strict restrictions heavily affected people's lives, but the majority of respondents support strict restrictions. So we see that the majority of respondents here strongly support strict restrictions, including full lockdowns and curfews. However, we also found that in regions that apply longer lockdowns, longer restrictions, or more cases of COVID-19, the level of support to strict restrictions were also reduced, meaning that the longer lockdowns would wear out the people patience. That's why their support reduced. So we see that even though restrictions are very important, but it would be very challenging to put them in place for long. And for other measures, such as strictly supervising mask mandates, etc. So 100% of respondents said that they support. And the measure that receives less support is the measure of closing all open markets or wet markets. Only 77% support this measure. Still fairly high, but compared to all other measures, this is a measure receiving least support because it affects all direct needs of the people, especially buying food. We also try to measure the policies and responses of the governments to see whether they are too abrupt to the people or if they are timely enough. And it is also to see whether the people were prepared for these responses by the government, provincial government, because the introduction of measures in abrupt manner would cause difficulties to the people, and 19% of respondents said that the provincial government's response was too abrupt. And also, we see that in the provinces with more cases or in the epicenter of the pandemic, higher percentage of respondents said that the measures were too abrupt. In order to reduce the impact of COVID-19, the government already launched various packages last year and this year. And this year, 2021, only 70% of respondents have heard about government's 26 trillion Vietnam dong aid package. And so we see that the poor, the non-skilled, or the ethnic minority groups have a lower level of awareness about this package. So we see that the information channel or communication needs to be more diversified for the information to reach the more disadvantaged groups and areas. And also for this package, we see that those who heard about the government's 26 trillion Vietnam dong aid package mostly concentrated in the more affected provinces. Now, when it comes to those who receive this support, 13% of respondents said that they have received the support. And there is only one thing that I want to mention here, that when we look at the families that receive the support in the poor group, this percentage is much lower than in other groups. And it suggests that the support has not been distributed and targeted to more vulnerable groups. And you can see from the previous slides that these poor families have really very heavily affected, caused by loss of income, and they even had to sell out their assets. So supporting these poor groups would help them to cope better with the impacts of COVID-19. The fact that the poor people receive less of the aid can also be explained by the following, that in the southeast, the region of Mekong Delta, in the four provinces of Ho Chi Minh City, Long An, Dong Nai, and Bình Dương, those provinces heavily affected due to long restrictions and lockdowns, and therefore support came more to these provinces. However, in these provinces, the poor, by the national poverty line, the group of poor is also smaller, and that could explain why the poor receive less of the aid compared to richer groups. For the timeliness of the package, the majority of respondents said that the packages were timely. However, about 20% of people who received the aid said that the amount they received was not exactly what they heard. So, I mean, checking of the reliability or the performance of disbursement of this package needs to be conducted. And also, procedures were not simple or streamlined for the people to receive the aid, the support. And besides the government support, there is also another very important source of support from the social organizations or charitable entities. So when the 14% of families receive support from the government, 25% of families receive aid from other groups or entities. So this is significant, and 6% receive support from their families, or relatives, or friends. And now please allow me to talk about access to public services in the context of restrictions and lockdowns. So our question is that during lockdown, was it difficult for you to get access to food? And 30% said that they had difficulties in getting access to food, basic food. So we see that's why closing wet markets did not receive much support from the respondents. And so for these essentials, and access to these essentials in the highly restricted regions such as the Southeast and Mekong Delta, people found that it was much more difficult for them to get food. And the level of access among the poor was also much poorer than the non-poor groups. For the use of public administrative services during the first wave of COVID-19, 23% of respondents reported using public administrative services during this time. However, we see that there is a very low percentage of respondents using online local e-service portal, only 3%. So one suggestion is that it's very important to provide access online for the people to get access to public administrative services. And as we expect, the use of healthcare facilities during the pandemic should be lower. But when we look at the quality of health service delivery, the good news is that the quality is still ensured. So 30% of respondents used a healthcare facility, and there is also a highly positive assessment of the healthcare facilities. However, more documents and travel documentation is required for those who have to use health services. That's why 5% of those who did not use health facilities said that they could not go to hospitals for their health treatment because of travel restrictions. Generally speaking, as a result of the impact of COVID-19 pandemic, the assessment or the view of the citizens about government's responses or policies became less positive. So even though the positive assessment of government performance is still high, but it has been declining in terms of handling the pandemic from 2020. And there is a strong support for strict containment measures, less support for closing wet market and schools. And on the 26 trillion aid package, the proportion of people receiving the aid package was low. The poorer had less access than the wealthier. And the online public services delivery is an area to pay more attention to. Now, I want to talk about citizens' preference and expectations for the time to come. Similarly to last year, when we evaluate the dual objectives of the government, we had a question. How many of you would opt for, would you opt for saving lives over economic growth? And 83% of respondents agreed to prioritize life saving over economic growth. However, the level of support also decreased in the more affected provinces and among the poor. So obviously the impact of COVID-19 on these groups was much more severe than in other groups. That's why that reversed the trade-off, even though they support, but the level of support subdued due to the severe impact they had to suffer from the pandemic. In terms of support to lockdown, the majority of respondents support lockdowns at a smaller scale, at the community or district or ward level rather than larger scale. When it comes to, I mean, just 1 month, more than 1 month ago, we saw a large wave of migrants traveling back home on their motorbikes. So the poor can cope with poverty by growing their cattle or animals or crops, which cannot be done in urban areas. That's why many workers decided to go home. And so there was a strong wave of migration back home. And so it raised a lot of debates and discussion because many people feared that that unorganized migration can cause more risks to public health. However, others would say that if we cannot support them more effectively, we'll have to let them and help them go home. So when we look at the citizen preferences, 57% of respondents supported migrants from epicenters to travel back to their own provinces. And also in the regions with significant lockdowns or restrictions and high number of cases, for example, in the Mekong Delta or in the southeast provinces, the level of support is also higher because citizens in these regions felt much more about the severe impact of COVID. So in our sample, we only asked people with permanent residence registration. We did not ask this question to migrant workers, but the local residents. So it expressed the view of the local residents. And if we ask this question to migrants, then this ratio would even be higher. So it suggests to us that people living permanently in the destination provinces really have empathy for those migrant workers having to leave their provinces back to their hometown. So there can be three major summaries, conclusions about citizens' preference. Despite significant economic impacts, most respondents clearly prioritize health over economy. And also, the majority of respondents also support lockdowns and restrictions, however, at a more limited scale. And finally, support to migrants traveling home also received a stronger support. More than 50% of respondents support. And finally, policy implications. Some implications could be seen from all these analyses. In order to receive the support from the people, I mean, for the effective implementation of the policies first need to be supported by the people. And also from party survey, we could also see that in the provinces with higher governance quality, people also show more support. And policies and responses need to target more vulnerable groups, unskilled workers or poorer people. And support policies need to be designed in a simpler and more accessible manner, especially during the emergency situation. And finally, public services should be reassessed and upgraded to be more user-friendly for higher utility of contactless means to interact with the government. So that brings me to the end of my presentation. Thank you very much. Thank you very much, Dr. Nguyễn Việt Cường, for your presentation for the last 30 minutes on the key findings of the second round of phone-based survey. And I hope that with the findings of the survey, we will be enabled to work better in our policy-making efforts, particularly when it comes to the policies that have important bearings on population's lives. And next, for the panelists session, we would like to invite the panelists, Madam Phạm Chi Lan, independent senior economist, who is a member of PAPI National Advisory Group since 2009. And Madam Chi Lan is joining us via Zoom. So please allow us to project the screen to share with us Madam Chi Lan's screen. And the second panelist is Professor Nguyễn Anh Trí, member of the Parliament and member of the Committee for Social Affairs of the National Assembly, also joining us via Zoom. And the third panelist is Ms. Nguyễn Thị Lan Anh, President of the ACDC. Ms. Lan Anh is here with us on site. So Ms. Lan Anh, could you come up here with us? The fourth panelist is Dr. Trương Minh Huy Vũ, the director of the software technology tech park, Ho Chi Minh National University. He is also joining us via Zoom from Ho Chi Minh City. Dr. Vũ, hello. Yes, so please share 4 panelists' cameras on this live stream. And fifthly, Dr. Nguyễn Thắng, Vice Chair of the Socioeconomic Policy Advisory Council of VISS, also joining us by Zoom, even though he is in Hanoi. So we've got 4 panelists joining us via Zoom and 1 on site. And, you know, it is quite common these days that you may have had contact with some infected person. That's why we have the flexibility of sitting at home and talking to each other via Zoom. And in this session, I would like to invite Dr. Phùng Đức Tùng to co-facilitate the session with me. Dr. Tùng, can you come up here? Welcome panelists who have agreed to join the panel discussion. And this panel discussion aims to provide greater insights into how Vietnam has responded to the COVID-19 pandemic, especially with the ongoing fourth wave of the pandemic in 2021. Through their insights and COVID-19 related thematic research. And I hope some from the organization team will let us know how many minutes each panelist has had. So 5 minutes for each panelist, right? We wish to have 5 to 7 minutes with our distinguished panelists, and then we'll address questions from the participants here and online. And firstly, we would like to ask Madame Phạm Chi Lan, Senior Economist and former Vice Chairperson at the Vietnam Chamber of Commerce and Industry. And we've got two questions for you, Madame Chi Lan. Firstly, how do you find the findings from our research that we have just shared today? And our second question to you is that from your great insights in governance matters, not only from business but also from citizen lenses, what are the 2 or 3 priorities that Vietnam should take to address some of the key institutional challenges facing citizens during and post COVID-19 pandemic? The floor is for you, Madame Chi Lan. Yes, thank you very much. And I'd like to thank UNDP and the organizers for allowing me to join this panel discussion. I am of high opinion about the survey and its key findings because they also echo what we have heard from the media and our own views, because we have heard the people's opinions and feedback. And we understand that the situation is exactly what we heard from the key findings of this survey. And the good thing about the survey is that it can quantify the responses about opinions and experiences of the citizens. That's why it gives us a more reliable picture of citizens' opinions and experiences, and letting us know how citizens have been supported by the government's responses and how they support the government. And I'm very impressed with the results on the level of confidence and trust of citizens in the government's responses and local government's actions during COVID-19. Even though we have to say that sometimes we found the policy measures may be too heavy, too restrictive, too strict, and affecting a lot the livelihood and well-being of citizens in all over Vietnam. So I think that Vietnamese citizens are very tolerant to the government, because, you know, in this very difficult, challenging time, having this high level of support from the people is a great thing. But I think that we cannot find it anywhere else. That's why the government needs to focus much more on improving its policy responses and measures in order to deserve the confidence and trust put to the government, in the government by the people. And what is a pity here is that if we could interview also the migrants who had left major cities like Ho Chi Minh or Bình Dương or Đồng Nai back home, then it would give much more value to our survey findings. And also, survey gives us a very fair assessment of citizens about the support that they receive from the government and from the community. And we see that 25% of families receiving support receive the support from the charitable organizations. Also suggest to us the strong community sense among Vietnamese people, which is precious in our culture. And we also suggest to the government that it's very important to improve the ways in which the support is conducted, so that support can reach the people rather than having to go around so many cumbersome procedures. So direct support from social groups and organizations went straight to the hands of the needed people at the right time. That's why the benefit and the positive impact here has been seen as much greater than the government support. And therefore, for policies to be developed in the future, they need to be improved in the ways in which the government listens to the people for policies to be improved. Regret to say that this year we do not see improvement in accessibility to the aid package provided by the government this year when compared to last year. Not only UNDP surveys, but various reports from different organizations also say the same thing. That the level of access to the support package this year has not been good. Last year, we did not have a very good performance, and the same situation happens this year. So it's a pity, because if we could learn and draw lessons from last year's experiences, then the performance of this year's support package would have been much more impactful or beneficial to people, not just limited to 14% of citizens or families receiving support. So if we want to have the consensus as suggested by the team, we need to be listening more attentive. People's voice needs to be heard by policy makers, because in reality, we may see that the differences in the level of performance of the government depends on the ways in which they conducted their measures and their approach in implementing policies. So while there is one policy from the central government, the level of implementation varies quite a lot at the provincial level. So it requires local governments to adjust ways of conducting or implementing support policies, and also the flexibility that would be allowed to be adopted at the local level. Creativity, innovation are required, and also strict sanctions against anyone who stay in the way of helping our citizens. And also, measures need to be undertaken to address for those who do not perform even right in the public authorities, because otherwise in the future, when we are faced with similar crisis, we will again repeat the mistakes this time. And thirdly, the support package may need to be bigger and big enough to support the people, because from people's responses we see that the level of support is very modest. And for poor, for vulnerable, disadvantaged groups, the most vulnerable groups receive least support and less than disadvantaged population. And so it means that the support is not enough and doesn't help them much. Therefore, what the survey's findings suggest is that the size of the support package needs to be enhanced, needs to be expanded. And this view should be heard by the National Assembly. The support package to be launched by the government needs to be bigger in size to be sufficient to support our citizens. Otherwise, it cannot help them get out of difficulties. Bigger package would support not only the citizens, but also spur economic growth. So we don't need to be worried that bigger size package would place more burden on the state budget, because the bigger support would mean that citizens and families can go back to their business and production, and some economic activities can revive thanks to the support. That's why we don't have to be worried that we will lose but not gain benefits with spending a bigger support package from the state budget. So support package needs to be approached in that way with that mindset. And apart from the big enough size, it should also be timely enough, and also targeting can be better. And I don't think that the government should be aware that targeting is not right, or benefits may be given to people who do not deserve, because that objective is less important than the major objectives of a social support package. And unfortunately, we see that the online public administrative services is not performing well, while among people themselves, online services are used quite frequently, but the public services is not at that level, and that needs to be improved. Thank you, Madam Chilan, for your insights into the support package for vulnerable and disadvantaged groups, the role of social organizations and charitable organizations during the first wave of the pandemic. Thank you very much, Madam Chilan. Yes, lots of the points that Madam Chilan has just shared with us points to us the disruption or the gaps in policy implementation. So for the first time, the Prime Minister talked to 10,000 chairmen of communes and districts to fix the various implementation of policies at the local level. And also, he talked about promoting the use of online public services to the people. So yes, definitely, these are important areas to be paid more attention to by policymakers and policy implementing agencies at the local level. Secondly, I would like to invite Professor Dr. Whitney, National Assembly delegate, National Assembly Committee of Social Affairs, who is dedicated not only in the healthcare sector, because Professor Mdri is a medical doctor. He is also a dedicated member of the parliament with lots of thoughts put on the groups of people with disability and health aspects. Dr. Chi, which aspects of the findings that we have just shared would make you think the most from a social policy point of view? Particularly after in the post-COVID period. And the second question is that we understand that in the full National Assembly session lately, the National Assembly discussed important policies regarding COVID-19 response. And could you please share with us what are going to roll out to assist citizens to overcome hardship in 2022? Good morning, everyone. Well, first of all, I would like to thank the organizers for allowing me to participate in this very meaningful event. And I'm sorry that I cannot be there with you on site. I know that prominent people are attending the webinar. Madam Chilan, good morning. Yes, we wished that I wished I could be there with all of you. But due to a direct contact with an infected person, now I have to sit at home and talk to you by Zoom. So to respond to the questions asked to me by Huyen, first of all, regarding Dr. Kuang's presentation, I would like to have some feedback. Very interesting presentation. So I found that, yeah, the scope of survey the topics of surveys are quite well selected, and the issues and the questions that you asked during the surveys are also right to the spot. Only one missing. Yeah, I mean, if you can refer to some international comparables, then that would have been, it would have added more value into this insight. So has there been some comparative perspective that would have been much more interesting? The thing that I'm impressed with the most in this survey, actually, Madame Phạm Chi Lan has said what I wanted to say, and much better than me. So I just want to add one more point to that. I'm also very happy and touched in seeing that the majority of people supported the responses and policies introduced by the COVID-19 Steering Committee and the Ministry of Health. The level of support is high, and that is precious, because we have to agree that great efforts have been exerted by the government, by the Prime Minister, by the Ministry of Health. So touching moments and images have been seen during the pandemic. Of course, there would be many things we are not satisfied with, but the determination, the effort, the urgency, and the agility in policy making and policy responses is the best thing that we admire. Because the pandemic is unprecedented. And you know, even for me, the previous day I say something, but immediately the next day I found that what I said yesterday was not true anymore, was not right anymore. For example, you know, schooling for children. Yeah, at this moment, we think that it's the best benefit of the families and children that we reopen school and bring them back to school. However, with 500, 700 new cases in Hanoi and infected people everywhere, then we thought now we had to reverse the decision. And we may need to adopt a more flexible approach of allowing students back to school only when it's safe for them. But one thing I know that disturbs our minds the most is the remigration of migrant workers. Yeah, the running, yeah, in panic, the panic run of migrant workers, because millions of people fleeing the major cities back home on motorbikes. This is a panic, and this is a failure, I have to say. This is not nice to see at all. Very hurtful, painful to see millions of people leaving the major cities, going back home. And as a doctor, I have to say that in principle, especially during the pandemic, you know, this is like a fight. So you cannot escape. Yeah, for a pandemic, you know, it's not like in the war, escaping from bombs. Yeah, you know that during the war, if a bomb is dropped, you just want to escape to a safer place. However, we cannot apply the same principles for pandemic, because in the pandemic, if you flee, it means that you would bring the risk back home. to your own city, to your own province. And that panic run out should not have happened. And so we called, we urged, and we heard that the Prime Minister also said on video that not encourage people to go home. However, they cannot do anything else because for the migrants, they could not stay longer in the cities. They run out of means. They don't have money. They cannot rent houses anymore. They don't have any income. Where else can they go? If they cannot be afforded, if their essentials, their necessities are not afforded. So they run out of all means to continue to stay. So it is like a force measure. The last situation that they had to make this inevitable decision to go home. So I mean, depending on the perspective, very difficult decision to make on policy making. And that's why later on, the only thing the Prime Minister could do is to call for the provinces to provide any possible support to the migrant workers that were traveling home. So, I mean, really flexible policy conduct, but it is a dear lesson for everyone, every province and every government official. So there is one thing that I cannot afford to not to mention in this response is the government's support to the people. How should it be like? What should it be like? Yeah, because you asked me that what will come out from the National Assembly's discussion. It's fair to say that the National Assembly have learned a lot, but it is not that easy to come up with a new resolution with a very strong developments or strong measures. The National Assembly tried their best to be able to come up with good policies for COVID-19 pandemic. And the National Assembly particularly concerned about supporting citizens. And the National Assembly adopted the 62 trillion support package, followed by the 26 trillion package this year, 2021. And there are other support measures in one way or another, supporting businesses, supporting families, supporting citizens. And resolution number 30 of the National Assembly tries to remove all the impediments and obstacles in the economy, but especially procurement of medical supplies and chemicals and medicines, etc. So it is the resolution adopted to cope with emergency situation. So coming back to the support package, I agree a lot with whatever Madam has to say. So I will not repeat, just one more point to add. The government, and more precisely, Molisa departments and Dolisas at the provincial level and other relevant agencies were not drastic enough, not aggressive enough in supporting our citizens, I have to say, because I was part of the oversight mission who oversaw the implementation of disbursement of the 62 trillion package. The Committee for Social Affairs of the National Assembly, and we went to a province, which I do not want to name here. Okay, so of all the targeted population groups, which were supposed to receive the support, only 2 groups did receive support. And then I asked why, because the only 2 groups that received the support are the families with people with meritorious credits, and they received the support, and the poor. While other groups who were also affected by COVID-19 in a severe manner, they did not get any support. And I asked why. Aren't there anyone in your province that have to skip meals? Aren't there anyone in your province that were not found in difficult situation? Couldn't you find anyone to support? And I told them that you don't have to go anywhere far. You just need to go out to the street. If there was a street vendor who used to be there every day, and now she's not there anymore. Yeah, it means that because she cannot earn any money, and you have to find her to give her money, right? Because they are the people who deserve to receive the support. And I highly agree with Madame Chilan that it's okay to make mistake. I mean, to support the people who is not so poor. Yes, because, okay, there are good people, there are bad people, but then it doesn't matter. There are greedy people, yes, okay, because this is a society, but will not be that many, and it's only food, it's only rice, right? Even if they're greedy, they cannot get much for themselves. And that's about the last year package, and now 26 trillion package in 2021. Strong statements were made by the government, and I was confident. I used to be confident that we would succeed this time. However, the disbursement level is very low, even from the last year package. And I have not, do not have the exact figure for disbursement for 26 trillion package, but from what I understand and what I heard, I think that the disbursement performance is still very poor. And also, I find your survey findings very interesting, and I promise to you, I will make recommendations to the Social Affairs Committee of the National Assembly to organize an oversight of disbursement of the support package to affected people. And it's very important that we draw dear lessons from our failure in implementing those packages. And right with the first package, we said that we need to replace the officials that are not performing. But you know, it is the situation is still poor, and it raises the most concern among us. For the National Assembly work in the last few days, Social Affairs Committee worked with the Ministry of Health and the government to issue a resolution, a special resolution of the National Assembly for COVID-19. For example, in terms of recruitment, in terms of policies, and also allowances and remuneration to the frontline officers. The frontline officers have suffered a lot from the beginning of the pandemic. And they were put under pressure, both the physical and mental pressures, because they work round the clock. Yeah, almost 24 hours a day. And so it's not 8 hours or even 16 hours that they work. They work around the clock. And they were the most suffering people during this pandemic because of the high pressure, because they have to deal with severe and heavy patients every year and death every day. And many medical workers came back from the emergency situations distressed, depressed. So apart from their physical suffering, they suffer severely from mental distress and depression and pressure. So lots of medical staff and medical workers here have to put with the most cruel and hardship conditions during their work. But then the remunerations and the rewards to them were not at on par with what they sacrificed for this pandemic. My final point is that we will continue to face uncertainty and more challenges with COVID-19. So as a doctor, I have to say that we have now moved to another stage of the pandemic. Yes, counting the number of new cases has to be done. However, what we have to pay more attention to take more care about, is the number of severe conditions, more serious conditions patients, and how can we save lives. So don't make situation worse. And we have moved to another stage of controlling and fighting against the pandemic. And it requires us, from us, agility. And I think that we also need to take this dynamic mindset in conducting research of this type. And I hope that the conclusions or the feedbacks that we receive from this discussion today can be consolidated and then sent to the National Assembly's Committee of Social Affairs. Thank you very much for listening to my feedback. Thank you, Professor Chi. Yes, we look forward to receiving and sending these great insights to the relevant responsible agencies, and I hope that it will not be F0. So the next question is for a panelist who comes from a center working with people with disabilities, Ms. Nguyễn Thị Lan Anh, a founder and chairperson of ACDC. And ACDC and UNDP are now working together on a survey, a quick survey, a rapid survey on the impact of COVID-19 on people with disabilities. So Ms. Lan Anh, we would like to invite you to share with us the overall, the impression about the overall findings of the survey, and with the practitioners and policymakers here. What can you share with us from your perspective, and in your opinion, what needs to be done to support people with disabilities to overcome this hard time? What should be the role of the government, and what should be the role of the business community? Thank you very much for inviting me to join this very important session. And I'd like to share with you that currently we are conducting a quick assessment on the impact of COVID-19 on people with disabilities. And it is conducted jointly by ACDC and UNDP since September. We expect to disclose the findings in January 2020. And with this quick assessment, the scope is broader than the first survey the findings of which were launched in May 2020. The sample is also larger, 2,000 in all provinces, and covering people with disabilities as provided or defined in our regulations. And in this quick assessment, we tried our best to cover the types of disabilities to be covered, because questions may be hard to be answered by certain types of disabilities. For example, we've used a short questionnaire with the sign language interpreter for deaf people to answer the surveys, the questionnaires. And we could only share with you some highlight results, because we want to keep the results until January. We rely on the network of organizations supporting people with disabilities in all provinces of Vietnam. And 26% of the respondents were really are found in a severe disability situation. And the ways in which we conducted this survey is also similar to this survey between Mdri and UNDP. And it also has some similar findings. But the target population of this survey are people with disability. So just different targeting, but some of the findings are quite similar. And what we found is that COVID-19 has had severe impacts on all communities, including people with disabilities, particularly employment for people with disability worsened quite a lot. 74% of the respondents said that they have lost partially or fully their job. And this was 1.5% higher than last year. Last year, the ratio was 49%. Loss of income was also reported among 57%, saying that they receive only 2 million dong per month, including already the allowance from the government. And income from their job reduced by more than half. In terms of health facilities, they were found in a more difficult situation to get access to health services. And they said that the monthly health services that they would typically be receiving stopped. And they could not go out to even buy medicines or medical supplies. When it comes to social security aspects, people with disability also experienced poorer social security, and only 20% of respondents received the support from government's packages or policies. And 33% received support from the social organizations rather than the government, not the government. Similarly, about 33% receive food from social organizations, civil society. So there are several implications that we would like to propose here with regard to social security. People with disabilities need to be supported in a more sustainable manner to avoid leaving them left behind. And also, it's important to support people with disability by creating new jobs for them, more adaptive ways of creating jobs, such as IT jobs or online sale. Thirdly, psychological counseling and healthcare services, rehabilitation services to be provided at home or even remotely. Because for psychological or mental support, for example, this type of support can be received online. Because if there is an infected person in the family, then the F0 will have to be quarantined, leaving just the person with the disability at home. And that would make the situation worse. And we also see that the businesses run by people with disability also do not receive support from the government. And they seem to have been forgotten by policies. In terms of communication, the safety practices need to be communicated in a more effective manner to people with disabilities. So these are some areas, some aspects that we found out from our survey. Thank you. Thank you very much, Ms. Lanang, for such food for thought and further actions to assist people with disabilities during this hard time. And I think that this is a very important supplementary suggestions for a fuller picture, which will help the government to come up with more overarching, holistic policies and measures, responses for the upcoming periods of the pandemic. And now I would like to turn to Dr. Chiu Minh Huy Vũ, Director of Ho Chi Minh City Vietnam National University Software Technology Park, who has also served as a Vice Team Lead of the COVID-19 Response Advisory Board for Ho Chi Minh City Municipal Chairperson. Dr. Vũ, you are now living right in the middle of the most severely hit epicenter, Ho Chi Minh City, where our respondents also shared bitter feelings and experiences than in other places. Could you please tell us what you think of our findings from the survey findings? And more importantly, what are Ho Chi Minh City authorities doing to address the surmounting difficulties facing both the citizens and local governments there, especially during the current surge of COVID-19? And what do you think could have been done better in order to mitigate the impact of COVID-19 on Ho Chi Minh City? And if you have one piece of advice for other provinces to learn from Ho Chi Minh City, what will you have to say? And how should it be conducted? The floor is for you, Dr. Vũ. Thank you very much, organizers, for allowing me to speak in this panel discussion. Lots of important questions, and I may not be able to cover them all. I just want to share with you some highlights, share with you my thoughts. Firstly, with regard to the survey itself and the findings, I agree and support the previously said points by Madam Chilan and Dr. Professor Chi on the necessity and significance of the survey findings. We've heard a lot about the citizen support and the view of the majority. And PAPI is among one of the most important instruments to help us hear from the citizens over so many years. And also with this survey during the pandemic, 1.5 thousand people sample is very good thermometer or barometer for us to measure people's opinions and experiences with the government's responses to the pandemic. And it is very important for our understanding of the high-level picture of the pandemic in recent months, and also the findings of the survey coincide with what we think, and I believe many other researchers and policy researchers and managers in Ho Chi Minh City. For example, comparison between, the levels of responses of governments in 2020 versus 2021. We see the varied performance, which raises the questions why. Because these are the opinions of our citizens and also their experiences. We also realize barriers, administrative barriers in getting access to health services and social security, which is very important because it should have been that in emergencies, we should have been able to introduce emergency measures, but then we tied our own hands. The governments introduced the restrictions to tie our own hands. And many of the poor performance here was attributed to the limitations and the shortcomings in the actions of the government. And the third point that we heard from the surveys that we need to look deeper into later on is technology and responses by the citizens based on different platforms, because learning from the world's experience, we see that technology should play a very important role. However, looking back at Vietnam's situation, the provinces in the Mekong Delta and Southeast provinces, we see that technology efforts, even up to now, are very unstable, have not been so effective, if not to say a disappointment. Disappointment from the perspective of those who are working in technology and managing technologies. Because even though lots of technologies are available out there, but we have failed in adopting technologies to help ourselves out of this emergency situation. So I think that it's a big regret. And I have two views to share with you here. Firstly, from the responses that we heard every year, and also from Ho Chi Minh City, the sample, the puppy sample, this survey sample is 1,300 people, but the sample size from Southeast, Southwest, and Ho Chi Minh cities is very small. 10 million people of Ho Chi Minh City, and given this population size, given the level of impact and severity of impacts on Ho Chi Minh City, and in the last 4 months, Ho Chi Minh City was an epicenter, and it should be the epicenter of health services, social security, regional connectivity, production disruption, supply chain disruptions, and also the center of national security issues. And the sample size is very low, only 20-something percent, does not really reflect the magnitude of the opinions and experiences of those who live in this epicenter. So it means that there would be a significant gap between what we received in the survey and the reality. So what I'm suggesting is that you need to look at the proportionality here. Second point, a bit off track here, but when the pandemic is unprecedented, we've never seen such a thing before. And also, it is the first time for Vietnam to face with a new variant without any relevant experience. So the approach, the concept, the terminology. I mean, when you conduct a survey, you conduct a survey about phenomena, right? And then we have to conceptualize this. We have to make it into discourse. We have to define the terminologies. And this is, debatable. And this is controversial. And almost nothing is there at the conceptual level. For example, what is meant by social distancing? What is meant by lockdown, soft lockdown, hard lockdown, limited lockdown, broad-based lockdown, treatment, and then treatment hospital, or just admission hospital, admission or treatment. So, the Secretary General of Ho Chi Minh's party's committee said that, okay, we open this facility and we'll bring the infected people in there, but no treatment is provided, right? So the concepts, and even post-pandemic, post-COVID is not the right term. What do we mean by post-COVID? 2022, 2023, 2025? Because COVID pandemic will still be there, and we don't know when it will subside or disappear. And also in the context of, in the absence of many instruments, vaccines is not there, and then people have to go out desperately to save themselves. Okay, so that for a person who becomes F0, now they are no longer afraid. Because just 7 months ago, hearing that I am F0, they would think that I'm going to die tomorrow. So now that mindset, that way of thinking is no longer there. Yes, and even the cure, the medicine. Yeah. And then people's mindset, mental status changed. Now they are no longer afraid of getting infected. And vaccination improves the people's optimism, positive thinking. So new concepts, new terminologies have emerged, and time is needed for everyone to understand the same things and to be on the same page and to speak the same language. Why am I saying that? Because responding to the second question by the MC, what measures need to be there and what could have been done better? I think that there is one saying that that if there is a if, right? I can put Paris in a bottle. So it's impossible to say if. Yeah, what could have been done better? But I think that we could learn from the failures, from the dearest lessons of the past. Yeah. Be transparent and be sincere to the people. Because when we have nothing, when we have no experience, right? When we see that the situation is unprecedented, then we need to be transparent. We need to be open to the people. We need to tell them everything. Because if we don't open and we are not sincere, we disguise and we keep information, we hide information from the people, everyone will get panic. So communication is very important. Discussion in a transparent manner, honest and sincere manner with the people is very important. And that's the dialogue mechanism between citizens and the authority that was opened in Ho Chi Minh City. So two-way communication is very important. Yep. Like a person can make a call from a certain ward and district in Ho Chi Minh City and say that, well, I have not received support. Why? And then the government needs to step in right away. Of course, if the local, the community level, grassroots level officers are performing better, then people would benefit more. But if not, then they need to have some hotlines or some channel to ask questions and to be responded in an honest manner. So a model for interactions between citizens and authorities is a very important lesson for us to learn from, because it was very clear from the early periods of the pandemic, right? You know, if a phone call is made to an infected person and then they did not pick up the phone, so you immediately understand they are in severe condition already. So, I mean, enhancing communication and sharing and exchanging information is the most important. Second, the role of the grassroots level entities, like the commune level, the ward level authority. So the lower you go down, the more limitations and gaps you would see, very sadly to say. Very limited in terms of their preparedness, their awareness, their knowledge, their responsiveness. So a policy can be very good from the central government to Ho Chi Minh City authority, but then it loses out a bit from the city to district, and then part of that good intent continues to be lost on the way from district to commune and ward level and so on. So, you know, actions and quality of implementation at the grassroots level, frontline level is very important. Because however good policies we may have at the central level, without good performance at the grassroots level, our citizen would not benefit. So it brings us back to the role of the municipal authorities, Fatherland Front, People's Council, and most importantly, the authority at the front line with the direct contact with the people. And they need to be the most competent people. You should not send the least competent people to the grassroots frontline level. They need to be remunerated properly. If not salary, then allowances. Remuneration needs to be sufficient for them so that we can deploy the best people to the front line to have direct contact to support our citizens. Thirdly, technology. When it comes to technology, we need to promote technology, of course, and it's very important. And so managing a city of more than 10 million people is a daunting task. And then you cannot do things manually. Even in Bình Dương, yeah, Mr. Thang, you know it, right? Yeah, just 2 million population, but you know, too many people to allow us to work manually. Technologies will have to help the new policies of adaptation, safe adaptation. So data collection, data management is very important. We cannot afford to have a fragmented, siloed ways of data collections and management. And we need to leverage on big tech firms or even startups. So organized data provide open public data and allow access to data for management purposes. And also finally, with regard to PAPI and similar surveys, technology will act as a sensor to measure people's responses or reactions to the government's responses, and also to the pandemic, because the number of new cases tends to increase. But if we have a good database, we will see that who are they, right? Are they vaccinated? do they have diseases, chronic conditions? So with good data, we will be more confident and to adopt the new policy for safe adaptation and not having to go back to the extreme restrictions because of fear. And all countries around ourselves are moving. Vietnam has also been moving and developing. So contactless platforms will give us great opportunities to accelerate the application of e-services, digital services. And Ho Chi Minh City has already developed a database on vaccination and social security and access to the support package. So this is a very important platform that needs to be expanded and improved so that the business community can get use of these facilities. And also the citizens can tap on this to serve their own purposes. I mean, their own safety and livelihood. Thank you very much. Well, thank you very much, Dr. Vũ, for your insights from Ho Chi Minh City. And these are really precious for us to link what is being discussed at the central level and what is going on at the local level. And these give us precious lessons, not only for Ho Chi Minh City, but also other provinces, and particularly the central government, to learn from your experience. And now I am turning to Dr. Nguyễn Thắng, Vice Chairman, first the Vice Chairman of Socioeconomic Policy Advisory Council of Vietnam Academy of Social Sciences. And there are two questions for you, Dr. Thắng. Could you please tell us what you find in common regarding citizen concern and expectations when you look at this survey and other research that you have done at VAS? And the second question, from the policy perspective, what do you think Vietnam could have done better to mitigate negative impacts of the pandemic? And also, if you have one piece of advice for the central government, what will you have to say? Yep, the floor is yours, Dr. Thắng. Thank you very much, the organizers, for allowing me to speak. I'm very impressed with the findings of the surveys and also great insights from the panelists. For the sake of time, I'll focus on very briefly on the responses. First, similarities, the things in common regarding citizens' concern and expectations. So we see that we have also conducted the research on the responses of the vulnerable groups. And most recently, we conducted a survey, the latest round in July and August. And so from our surveys, even though, you know, sampling frame different, because our sample came from the VHLSS sample, and your surveys sample comes from puppies, but we share similarities in terms of the targeted groups. We oversample also the provinces which are epicenters, and also adopted the measures provided under resolutions 15 and 16 the most. And we found similar consequences such as loss of income, loss of jobs. So the timing of these surveys are similar, and the findings are also similar. In our surveys, we see that there are things that firstly, the mental health.
Cấp xã, phòng lao động thương binh xã hội cấp huyện. Thế rồi
And so we see that in the areas around Ho Chi Minh City, in our survey, 2/3 of the respondents said that they are very worried because they live in a very difficult situations of having no jobs and having to cut down on the expenses, even on electricity. So even though we talk about vaccine, but you know, mental vaccine may be more important than medical vaccines. So the mental health is an area that we will need to care more about. It's not just the tangible impacts on people's well-being. Yeah, not the traditional medical support, but also mental health support. If I am to say any recommendations or any advice, I would say that I share the same view as Vũ. We cannot say if, right? Because you cannot reverse time. We cannot do anything else for what has already happened. That's why I just want to add that we should refer to the approaches taken internationally, the best international practices. We need to learn from that. For example, for the vaccination, of course, we have issues with the supply, but we also have other gaps because we found that in Vietnam, we delayed vaccination for elderly people. And the screening criteria are fairly complicated. For example, blood pressure as a precondition for the elderly to get vaccinated. And blood pressure is used as one of the causes of delays for vaccination for the elderly people, while the elderly deserve to be prioritized first. And the criteria in international practice is very simple, right? So they just give vaccines to the oldest people, 80 to 90, and then 70 to 80, and so on. So I think that we don't need to complicate ourselves. We just need to learn from the best international practices. And we need to learn from that experience. Now, when it comes to any advice for the coming period for policymakers, my point is that now we prioritize both economic recovery and economic growth. And for economic recovery, I agree with Mr. Vũ that we should not use the term post-pandemic recovery, because there will be no post, right? If it continues to go on. And so we need to support the government and the National Assembly in developing the economic recovery approaches, and particularly prioritization. And targeting is very important for the support packages to be introduced in the upcoming periods. So if we want to run our business, run our economy again, we will have to do well at targeting and prioritization. And we need to know where to spend. For the fight against the pandemic, the frontline officers, medical staff will need to be prioritized. Yeah, because even in the advanced economies, you know, what they lack is not medical equipment or money, but human resources. Because the human resources in the healthcare sector are overloaded for so many months. So they need to be prioritized. And so second priority in the upcoming support package needs to be put on social security. In the Human Development Report 2015, UNDP already identified that there is a missing group in social security systems in Vietnam. 35% of the workforce are now working in the informal sector, and they are not classified as poor, so they would not be eligible to the official support policies because they are employed and they are not listed in the list of the poor. They are also not formal workers. That's why they are not captured by the formal social security system. They are not covered with social insurance or health insurance. And it became very clearly, especially in the Ho Chi Minh City area, the majority of these people work in the highly contacted, high contact environment, such as transport or restaurants or food and beverages and hospitality industry. So these are the missing out, group that needs to be supported and prioritized for support. And there are two things you can do for this missing group. For the informal group, we need to simplify the procedures to enable them to get access to support. We should not overcomplicate the procedures. And it's okay if we can support some people who are not eligible. But self-dignity is a sense among the Vietnamese people, so we don't need to be afraid, to fear that we will lose resources to dishonest people. There will not be many. And also, people working in the informal sector. And I would know, you know that there are also informal networks of the social support. So we need to change our mindset and simplify the procedures and also introduce the technologies in order to support timely to the informal workers and migrant workers. So these two priorities will help us to achieve two objectives. Fairness first. So we prioritize the heroes in this fight, in this combat. And also, we prioritize the disadvantaged people to ensure equality. And also, with the modest support that they receive, they will spend. And they will spend on the goods produced domestically. So we can kill several birds with the same stone. So whatever we do here will contribute to our economy, and they should all be good. So those are some of the additional points that I want to participate together with my panelists. Thank you very much.
Xin cảm ơn anh.
Thank you very much, Dr. Nguyễn Thắng, and all panelists for all your responses. And we are deeply impressed with all your heartfelt comments and inputs. For the second time, I would like to refer to the questions that you asked here, but also we would like to thank all the participants to our program, and we will provide you with the responses via Zoom and via Facebook because we don't have time left for the session. And now I would like to invite Ms. Diana Torres, Assistant Resident Representative, the Head of Governance in Vietnam, to have a few final remarks before we move to the final session of the Media Relations and Networking. And so please, Ms. Diana Torres. Xin cảm ơn chị Tuyền và xin cảm ơn tất cả các vị khách mời đã có phần thảo luận vô cùng.
We have the opportunity to have this dialogue today, which is very timely, and to hear the voices from different stakeholders, policymakers from the south, from the north, so we can really have a constructive dialogue. That's what we care about, really, is to opening the space for dialogue and discussion, and to hear from citizens and from all stakeholders, so we can enrich, have a more meaningful and enriching discussion, and also policy making and decision making. So today's event is coming to an end, and it's my great pleasure to start thanking everyone who has been joining us today online and in person from the Green One UN House. I would like to especially thank the research team from the Mekong Development Research Institute and our governance and participation team in UNDP. Allow me also to thank our partners, Australian government, Department of Foreign Affairs and Trade, again for your generous support in conducting this study, of course for supporting our PAPI program. That thanks to this contribution and to the partnership that we have established with the research team and Australia government, we are able to produce this very timely research today. I understand that based on the feedback that we collected today, we will be finalizing the study, and the study will be available, the final report will be available online in January. We also will see if we can share the slides with the participants that are interested, because I already received a lot of requests for sharing the slides with participants that are interested in digging more into the data that is there. And that's actually the purpose of this study, is to be able to produce data that will be helpful for provinces, for decision makers at central and local level, so as they continue confronting the COVID pandemic and its evolution. As we have mentioned throughout the webinar, the findings come at the right moment and allow us to look back on what works and what doesn't, and kind of prepare for what is coming for next year with the emergence of new variants. We had I don't pretend to summarize what has been discussed today, and we had already a very long discussion, but I just want to finalize with some key messages, probably just to kind of wrap up the discussion today. One of very important messages is that governance matters in terms of how the government effectively will respond to the COVID pandemic, and also will put in place a recovery plan. And Vietnam is very lucky to have high public trust so far, already for 2 years in a row. There is a strong public support on the government measures so far. Of course, there are differences that start appearing, especially from the south compared to the south to the north, and places that have been epicenter. And it's very, very important that decision makers take into consideration this feedback and this data that we are presenting today, as they assess and take stock of what works and what doesn't when it comes to designing future decisions. Citizens' feedback and opinions are very important, and to maintain the public trust, but also good governance in terms of transparency and accountability. We last year, and it was mentioned by Mrs. Caitlin Wilson today, we believe that the successful response from the government of Vietnam to the COVID pandemic is also due to an incremental improvement in good governance over the last 10 years. And this has been and thanks to these improvements, Vietnam is enjoying public support today when it comes to tackling the pandemic. There are different ways in which the governments at central and local level can continue collecting citizens' feedback and opinion, and we think that there is more room to use online and new technologies and applications to continue doing this on real time and assessing and having a reality check with what the people, not only the businesses, but also the people think it's important, and how the situation is impacting their well-being, and what do they think about measures. It's important also that we heard today a lot of feedback about the social assistance package and opportunities to improve and to really target the populations that have been harder hit by the pandemic. It's also very important that this social package is accessible, and because there has been a lot of criticism in terms of the complications and complexity for making the social package accessible. And the last point is that something that we are working a lot with different partners is making sure that a human rights-based approach is at the center of any COVID-19 response and recovery to ensure that no one is left behind. Meaning that every response or every plan needs to put at the center those that are most vulnerable, including people with disability, ethnic minorities, farmers, women, LGBTI communities, because those are the hardest hit and the more difficult to reach. So it's very, very important that any policy and program put those that are more affected at the center. So with this, I would like to thank everyone for listening today, for joining us, and yeah, we look forward to continuing in engaging in this discussion in other occasions. Thank you so much. Xin cảm ơn.
Thank you very much, Diana. Cảm ơn bà Diana Torres. Một lần nữa,
I wish you all good health, happiness, and success, and we hope that 2022 will come with more joy, more happiness, and more success. So I hope that we will see more green color and more fading COVID-19 icon. So our slides have been put up to the library of the party website. The presentation today is also uploaded to the web, YouTube and Facebook. Thank you very much for watching.